I got
It's 9 o'clock, and the Blue Earth County Board of Commissioners for January 20th of 2015 will come into order. First we'll say our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next we'll have our agenda review. Bob?
Mr. Chair, there are no changes to the agenda this morning.
I'll move the agenda.
Second.
All in favor say aye.
Aye.
Against? Passed. All right, Commissioners' reports on committees. Who wants to start that?
I can start. Mine's relatively short.
Go ahead.
Cancellations. I was up at the Emergency Communication Boards, the old RRB, the Regional Radio Board meeting. I went up to St. Cloud on that day that it was kind of stormy and got to sit in on a Finance Committee meeting. And they just talked about the future of the ECB board and where we're going to be going this next year and on how we're going to deal with some funding issues. It was a long trip up in the snow and worse coming back, but it was worth to be there in person. And then we had a couple people from Blue Earth County online, but they actually had a good turnout for the weather conditions, and so things are moving forward with that. And then our MRCI board was canceled from a week ago to last Monday, and everything's going pretty well there. The candy business is picking up after the Christmas season. We always get a little worried that the business is going to drop off a little bit. We're getting some new accounts, and things are coming along pretty well, and we finished the year with some money in the bank. So they did really well last year, and the programs are picking up, and things are going good over there. And I think that brings me up to date with the cancellations, mayors and clerks and whatnot. It was kind of a quiet week last week.
All right, Mark?
Okay. Well, let's start with I want you to know that I was gone, of course, and I didn't shirk my duties as commissioner. I was in Manhattan, Kansas, and they had the Mercury, Manhattan, Kansas paper. What they call it, the Mercury. There you have two counties kind of like us. I'll say it right, it's kind of fun to say it actually. Potawatomi County and Riley County. I'm not sure how they can figure into, because Manhattan's about 50,000 people, but they had one, they just call it Pot County, and they had people oppose their power line proposal. They had an article on gas prices, how it helps county budgets, and they actually talk more about the county than they do the city there, so I don't know how that works. Then they got building permits, all that's gone up, and then they even had some guy retiring, and they had a big article or ad supposed to honor the guy, so the retires just from a county commissioner. I don't know how long he's been a county commissioner, but anyway, that was kind of interesting. Then I came back, and we came back in the day that the weather started to really get bad, and then everything was canceled. It was that Thursday evening. Yeah. Drew texted.
Watch out.
So there wasn't anything that week, but then on the next week, the following here, January 14th, I did have Bob. We were there at our Regional and Economic Development Authority, and went over a number of visits, and a number of businesses that are moving right along, new ones. And then I had in the afternoon that day the statewide health and improvement plan. As part of our county, we have a person involved with that, and with the local entities here. And then Beyond Yellow Ribbon was that night, and we haven't had a meeting for that for a while, and we're moving right along with new developments, putting the Yellow Ribbon along with for Suicide Watch to work with us in Beyond the Yellow Ribbon. They both get confusing for people. And then the next day, the Friday or the Thursday, had January 15th had a Partners for Affordable Housing meeting and board meeting, and we're moving along. And we do have our Pedal Past Poverty fundraiser coming up, so I appreciate all your support. That concludes my report.
You have enough writers for that yet?
I can always use a couple more in my team.
I'll sign up this year. I don't have anything going on that weekend.
Oh, well,
The NACO Ledge is the week before
Oh,
that,
yeah.
so it's, usually it was NACO Ledges that stops and, but, no.
Oh, all right, yeah, then we won't have to, we'll just have you go out and you get your own contributions and yeah.
There you go.
Yep.
I can do that.
Great, thank you.
Will?
Yep. Mine's relatively short.
Our bionic man?
Yeah. You know, metal weighs more than on the 6th, Kip and I were at a septic tank discussion in Rapidan. A group of people out there looking at putting in a cluster septic system and are looking to the county for guidance and funding. So we're Kip and I worked on that. Then of course we had department heads on the 7th. On the 12th we had Brown County evaluation board meeting in New Ulm, and then on last Friday the 16th I was at the AMC directors meeting in St. Paul, and that was the first meeting of the year, so kind of neat to be involved in that organization and see how they work. And that brings us up to today.
Thank you. Drew?
Okay, last meeting, of course, January 6th. Then the 8th, Thursday, I attended the E2020, Envision 2020 meeting. It was over in the greater Mankato Growth offices, and the focus was they were going to be kind of gearing up for another phase. So the other planning and all the things we've done is they've done some review, they've done some feedback from the community, and now gearing up for a new phase for looking into the future here still. See if things need to be adjusted and changed and or added. And the focus KPA, which is a key performance area, this time was on community planning and regional governance. And so there was just not enough time in an hour and a half for everybody to get around and share everything. There's a lot of good folks there from our community. And so we set a date for the next week to meet also after that meeting. Same day, I went to the Blue Earth County Safe Roads Coalition. We meet usually at the MnDOT district offices, and had a good meeting up there about trying to plan things for this 2015. And then on Friday the 9th, along with Vance, I went to the US Highway 14 Partnership meeting over in Owatonna, and there was a good turnout there. I think close to 50 people came. We had our new representative, Jack Considine, who came also, and he used to come once in a while, I think, just as a city council person from Mankato, and now he's coming as a state representative. So, and then the focus, or one of the key areas I just want to mention that we talked about was the Corridors for Commerce program. I know we're all familiar with that, and the hopes are that the legislators will pick this up and fund it annually for $200 million. And if they can't do it annually, biannually. And so that would be sort of an emphasis, is to see if they can keep that program funded at a certain level, so people can, around the state, can use those funds. Later on that afternoon, I went to the GBRBA, which is a Greater Blue Earth River Basin Alliance meeting at the Mankato Armory. And we had a very good discussion there, and a presentation from, Craig Austinson, our ditch manager, and then a woman who works for, I'm trying to think what county it was. I'm really sorry, but they both put on a presentation on drainage. And a lot of the folks in the room were just conservation people. You know, there's a lot of people involved with GBRBA, but not anybody that's really just ditch or ag drainage. And so they had a lot of questions, and a lot of interesting things came out about ditch law, you know, and some of the changes that people might be looking for. So that was a very good meeting. And then on Tuesday the 13th, we had the follow-up for the E2020. Looking for, I used the word in my report here, task groups, but I meant focus groups. They're going to try to see if they can get some people involved with some focus groups. So I'd like to ask each one of us here, if you know of anybody in your district that would like to get involved with E2020 and be on a focus group, where they can kind of do some more review, come up with some new goals and strategies for our region. And then on Wednesday the 14th, I attended the Region 9 Development Full Commission meeting that we had down at the Mankato Government Center there. And immediately following, which we do annually, we had a holiday dinner. which everybody pays for, and that was at the Mankato Event Center, which was a very nice dinner. And the people who cater that event center is Charlie's Restaurant. They did a very good job. Very good food. People were really impressed with it. So it was a good evening for all of us. And then Monday was the holiday, Dr. Martin Luther King Day, and I was called to go and do a little volunteer work with Vine and got some good physical activity yesterday morning. I don't feel it too bad today, but a little bit. So it was good.
Were you doing
They have
some
you move
moving,
stuff or what?
Well, I can just say, yeah, OFC donated a room full of metal shelving, very heavy duty.
Nice.
Mm.
Kind of like what we have, like the ones we have up at the attorney's offices where you can crank them over on wheels and stuff, and
Oh,
they're
yeah,
big
those-
and 12 feet long. And
Oh, nice.
we took an entire room apart of those and loaded them into a truck, brought them down here, and they've got them figured out where they're going to section them off and use them for their archives and things like that.
Mhm.
Records.
That's very nice.
Yeah, so it was nice. They do a lot of little things like that.
Yeah.
Half the time it's for just, selling at their Vine store or something.
Mhm.
But, so some good volunteers there and one of their workers. I think they had one person from the Blue Earth County Jail helping too. Good young man helping us out, so that was nice.
All right.
That's my report. Thank you, Mr. Chair.
Well, I guess a lot of stuff that went over, we had our department head meeting on January 7th. Again, the Highway 14 partnership. On January 12th, I met with Amy Thomas from the State Auditor's Office about our annual audit. I had my Southern Minnesota Children's Museum board meeting on the 13th, and then I met with our county attorney, Mr. McDermott. After that, spoke about different issues that are coming up for the county attorneys and the board. On January 14th, at a Transportation Alliance legislative breakfast at the Kelly Inn in St. Paul, spoke with a lot of different legislators in reference to transportation issues. Our state legislator Clark Johnson was there, and a lot of them that are on the transportation committees. And then I went to, at noon, I had probation advisory board, so I had a quick drive. And January 15th, I went back up for a Transportation Alliance board meeting. And that evening, I had a Highway 169 corridor executive and board meeting. On the 16th, I met with Bob to discuss this agenda, and on the 19th, which was yesterday, which was Martin Luther King, I attended a discussion on race at the Good Shepherd Lutheran School in North Mankato. Very good discussion. Talked about race relations and different issues that are happening here in Mankato. And it comes to today. Let's see. No, we're a little bit early for Phil.
Mr. Chair, would you like to do a couple of administrative items?
I think that'd be a good idea.
All right. First item is the county board minutes for January 6th of this year.
So moved.
Second.
No, I wasn't here.
All in favor?
though. I read them, yep.
Second?
I seconded it.
Second. All in favor, say aye.
Aye.
Against?
I did read them, by the way.
I read 'em.
Pass. All right.
I'll move the bills. Second.
All right, any discussion?
I just had a couple questions, but find my notes through there. Okay. I was just curious, in the first week, that Emergency Communications Network, it says other capital expenditures, $18,000.
That's the annual fee for Code Red and iPause, kind of our emergency communication.
So that's for 215?
Yes.
Okay. So it must go, we started it last year, Code Red. So we just paid a partial for last year then?
That's my understanding, and then this annual maintenance would be at the beginning of every year
Beginning,
going forward.
okay, not when we started. And then MVTL Incorporated, environmental monitoring. 13,000.
That's testing out at the Ponderosa landfill,
Oh, like drilling
water
That's-
testing, those sorts of things.
for the, oh, okay. Comes out of their funds too, I'm sure.
Yes.
And then, shortcut switch we see periodically, just a building improvement for 21,000, I was just curious where it was.
That's some heat tape that was installed in the roof of the courthouse. We've had some ice dams and some water leakage problems, and so we've been,
Up here?
yep.
Oh, wow, okay. Virden Company, contingency capital, that's something that we thought we might spend, we finally did. Not sure. $12,000.
Yeah, that actually is repairs on the courthouse clock.
Wow.
Is it working?
I believe so. I haven't checked, quite frankly.
You're talking about the outside clock, aren't you, Bob?
Yeah, the one that has the, on the
That's an
tower.
expensive clock then now, isn't it?
Actually, it's about half of what we had budgeted, so.
Is that right?
Yes.
Okay. Is that still tied into the chimes then? Is that why? I mean, it's tied into that whole system?
Yeah, there was a whole computer system that needed to be replaced. We have many more chimes to choose from now, so if you have requests, I guess you can get those.
There you go,
to-
Drew.
I have a special request, can you send the menu to us then?
Yeah, we need a menu,
It's
yeah,
quite a
'cause I don't.
playlist.
Is it really? Okay. And then, week 2, just one question. Kramer North American, other fees for $39,600.
That's repairs on the Minneopa Tunnel, so the
Oh.
Public Works repairs.
Yep, the ones that were completed.
Mhm.
Yeah, okay. Thanks a lot, Bob. I have no
Anybody
more
else?
questions on the bills.
Anybody else?
I guess I see some right away. I don't know if there's like a Peters, 2 different Peters and a Polly.
All the right-of-way
Is that for-
acquisitions there are for CASA 1.
Okay, that's it. Okay, thank you. Sorry.
If there's no other questions, all in favor say aye.
Aye.
Against? Passed. All right, I guess it's time, Phil? It's your show, Phil.
Uh-oh.
I was up winding the clock before I got here.
You just walked in, didn't you?
Is that, I saw you on top of the roof there,
I got it
yeah.
going.
That was a,
I'm the chime guy.
so let me know.
Mhm.
Oh, I'm not gonna go there.
Yeah, we're not going on the same.
Well,
just chime in.
Well,
Just chime in, yeah.
All right.
Okay.
Mr. Chair and Commissioners, thank you for hearing the human service issues for today. I will say that I thought Jay might be here, but we had a blizzard the night of, it was that ground blizzard that we were going to have our Human Services Advisory Committee, so.
I'll join a lot of other things.
Yeah, isn't that right? There were a lot of cancels, weren't there? Mr. Chair, Board, I have several action items that we'll take as a group here, if that is your preference. And the first of those is under financial assistance. I'm actually going to group the first 2 items there because they're very similar in their nature. Lingua One and Lamano both provide interpreting services to us. And these are services that access the interpreter services and sign language for Lingua One for individuals who have English as a second language. The only difference between the 2 contracts is that Lingua One also offers a sign language interpretation and the other contract does not have that included. It allows us to, both of these contracts allow us to meet federal and state civil rights laws, which are required to provide meaningful access to people we serve. The rates are increasing by $1 for the first hour, from $45 to $46 for the first hour, and another $1 for the second hour, which goes from $30 to $31. And then the rate for the Lingua One contract with regard to sign language went up $2 from $95 to $97, and that's for a 2-hour time period. The term of both contracts, January 1st of 15 through December 31st of 15. So all the rates for both of those are the same.
ask a question?
Yes.
Typically, I'm just curious, you know, for our benefit, Lingua One and Lamano, would you say that most of that is phone interaction, or is it face-to-face?
Right, with these two, there's actually most face-to-face. There is a language line through the state that we also have access to.
Okay, so it's
and
separate.
that's almost primarily commissioner by phone.
Okay.
Yeah.
So this is more,
The
that does
local
provide more
folks.
quality services, because face-to-face, we all know face-to-face is the best way to communicate.
Exactly. So, and really both entities have a pretty big menu of languages. If it's an unusual language, meaning that we need to go to the cities to get somebody that speaks that language, that's when you'd be reduced down to the phone service.
Okay.
But yeah.
Do you feel we really get a good representation of our full language issues here in the city of Mankato? Because I know we have a lot of languages being spoke up in
Right.
the elementary schools and the high
Absolutely.
schools, and you know, you look at these, you're looking more, well, wondering if it's more the Hispanic or the Mexican speaking, but obviously it's so much greater than that here in
Right.
Mankato.
Right.
Do
That
you
would be the
feel we-
bigger amount,
Do you
bigger
really
share.
feel that these companies give a full
I think they try to contract with individuals from those communities, so in that way I would say yes, when we have that represented in our community in those primary dialects or languages. Sometimes you get into a dialect which some of the Somali and Sudanese communities have many dialects, and so I think in those cases I'd have to say I think we have a weakness there, because it may or may not be that we have somebody on contract that speaks that specific dialect. So I think this is an ever kind of evolving mission from these two organizations to try to match those needs and to hire on people from the community that can be contracted to do that service.
and one, you know, besides the language barriers, there's a culture barrier, and the importance of these companies understanding the different cultures, I think, is huge. Is it your feeling that these two companies really cover that?
Yeah, and I would say it's not a complete coverage. I think we have growth always, and our community's always changing, that sometimes you have folks that come in through immigration and they speak a language that maybe isn't well represented in our community. That's where we probably struggle, and then I think these companies rally around those needs and try to bring that up to speed. There is a lag sometimes in that. So you go to the cities and there's a well-represented Hmong population. We don't have a huge Hmong population here, but if we did have a Hmong population that started to grow, it might take us a while to really fully field the need for that community. And so that's kind of the ever-changing dynamic in these. And so I wouldn't want to say, Commissioner, that we have it all covered and we're excellent. I'd say we have a really good base and we're constantly trying to build on that base.
Very good. Thank you very much.
You bet. Next section is supportive housing. One item under there, comprehensive housing contract. This is actually just an addendum and just a language change, and it's from HUD, and really it is our contract with Hearth Connections to access housing funds and rental assistance for long-term homeless participants. HUD has a language change that we needed to get into the contract, but no payment changes or alterations affect any kind of the rates or the dollar amounts of this contract. It's just an addition of language. A 3-year period of time, January 1st of 2015 through December 31st of 2018. Next section, South Central Community-Based Initiative. This is our 10-county regional mental health service for adults. Sioux Trails Mental Health Contract is under this section, and they provide our psychiatric medication management, diagnostic assessment, and urgent care services. Like we do at our psychiatric hub, they have locations both in Brown County and Nicollet County where they can do some of this work. For the serious and persistent mental illness, it is a renewal contract. The amount of the contract decreased significantly by $20,000 from the 2014 contract, but actually no services will be decreased, and the reason for that is we've changed some of our formularies about how we share revenue. So prior, the revenue would come to the initiative and then we'd pay back the vendor, and now we're saying just keep your revenue. So that's the only difference there. It's really a math change. It's not a substance change with regard to provision of service. And there's not to exceed language in this contract at $214,635.45 annually. The term is January 1st of 15 through December 31st of 15. Next section, behavioral health services, 2 items under this. The first of those being Woodland Center. This is a secondary contract for our detoxification services. It really is our backup when Brown County Evaluation Center is not available. There's a per diem rate that we pay, which is $470 per day. The term is January 1st, 2015 through December 31st, 2015. Next one was a significant change in our community, Briley Board and Lodge. The previous owners decided to put that business and the facility up for sale, which they were able to sell at 516 West Pleasant. The placement agreement is for the new provider who purchased the services on January 2nd. They'll operate under the same name of Briley Board and Lodge LLC. The group residential housing rate for this service is actually set by the state, so there's not something that we have to act on in that regard. The term is January 2nd. That's when the change in ownership took place, to December 31st of this year, 2015.
I was wondering about that, because I know that the new owner sent mail out to all of us, I believe. I don't know if we got that letter, but, or did you forward it? I can't remember.
It was probably direct. They've been in touch with us as well, but maybe it was the same one that we all got copied of.
Yeah. But in there, it was still cloudy whether or not it was actually purchased. I thought maybe it was just a business arrangement.
I believe it was a full purchase and went through a real estate agent who made that deal, and we have recontracted. It was a little bit technical in its nature because we both have licensing changes and ownership changes. So I'm very confident that it was a change in both.
Oh, okay.
Yeah. But the name changing, not changing, was probably the most unique part of that. Is usually there's a name change, but in this
they bought
case,
the name too.
Yeah.
Yeah.
Is there, does the state, or is there any way how do they have any control over the type of people that buy a place like that?
They probably don't in the purchase of the facility, but from a licensing perspective they would. So it's licensed by the Department of Health. So in that way it's kind of a fresh start as well, where licensors will come in, and we also do some of that local licensing on behalf of the state, and so we're involved on a licensing level, and then obviously on a contract level it's brought to your attention. So.
Okay, well then maybe it should be a good thing for the facility.
Yeah, I think there's hope for the future that this will just be a good change for everyone, and it's an important service. There's no doubt about that. Public health section, there's a couple of items. Sacred Heart University, which is actually in Michigan, has used our facility in order to provide clinical placement site for nursing students who want to be certified as public health nurse, and that's specialty practice, and so they need some practical experience. And so we've had a long-standing relationship with them, even though I don't think the volume of students is high. Sometimes people, because of their desire where they're going to locate or relocate, we have had this be a long-standing contract. This particular one is restarted at January 1st, 2015, and it has an automatic renewal for up to 3 years if there's no changes. There are some termination language about 60 days before the renewal date or within 120 days of overall contract period. So there's a couple options if either party wants to terminate that arrangement.
Quick question. Yeah. I tried looking that up on the internet, and it kept going to Connecticut. And it's right by New York, right by the... So it was quite a ways out. That's the only one I could find.
Yeah,
I looked at 10, and all of them were Connecticut, Sacred Heart University.
Interesting.
And they have a nursing program and everything. So I just thought, man, that's a long ways away. So anyway, so it's Michigan.
Well, I understand it is Central Michigan in the contract. I did
Okay.
look at that because I too didn't know exactly what it was.
Okay.
The only thing, and I don't know this as any point of fact, but it's possible that some universities have locations in other, and
Oh,
that
there you
could
go.
be that that's the center of the
Or
university
the
and that they have
headquarters.
scattered sites.
Oh, I see.
Sometimes that happens.
Yeah.
I don't know that at all to be true, but I just wonder because when
Yeah.
you Googled it, that it came up that way, maybe that's the
I
home
know.
base.
I used Bing.
Oh, yeah. So maybe a Bing Google combination, that's interesting.
The question I had though is, does it seem to ever create any conflict with our own nursing programs that we have here in Mankato? I'm not sure if they have a community nursing program at SCC, but I know they've got one at Mankato State University.
Right.
And I don't know if it would push out people that live locally that are going to school over.
Right. I'm going to give you a selfish answer, which is nurses that are interested in public health are far and few between, so
Oh.
there's not a volume problem with this particular
Okay.
area. And so when we post, a lot of times we've gone to hiring social workers instead of public health nurses because they're so hard to come by.
Wow.
And to be very frank, they can make a lot more money
Sure.
doing shift work at the hospital.
Right,
It's a
right.
different pay scale. But it's also a very different package. So we've been able to carry this, and part of it, this contract, and I think some of that uniqueness of the fact that we're drawing from a large area is to try to look for whoever might fit and want to be in a community like ours, and we're open to that. So that particular part isn't competitive, and
It's
I don't
not,
think we have a problem there.
It's a different lifestyle though.
Yeah.
Because here, it's a day job.
That's the great, yeah, I always think in terms of package deals, and I think
Yeah.
we offer a very competitive and good package. It's just very different than working in a hospital. Yeah,
Yeah.
that's right.
Oh, yeah.
Oh, yeah.
Right, everybody says yes, yes.
No, I know.
Right, and as some of you know, my oldest daughter just graduated in nursing too, and she works in a hospital, and that shift work and other things, it comes with a price, there's no doubt. And I think people that go into public health really have, that education, passion, and that idea of doing prevention work. So it really attracts a very certain person that is a good fit for public health. Next issue is UCare, and this is also a unique one. It's a retroactive rate increase. I think there was a glitch in that they sent it out, I think even to Commissioner Campbell into 14, where it would have been Commissioner Purvis that was our board chair, and so somehow in that whole mix this got lost. And so the good news is we're going to be able to back bill for a lot of our services, and I think it will be an important thing to go back and try to gather up. You'll see that the purpose of all these programs under UCare are to pay for that elderly population over 65 for preventative health. And the mission is to try to keep people in their homes as long as possible. I mean, that's the underlying mission. You'll see the rate increases don't sound significant in $1 in one category and up to $6 in other categories, depending on the type of service. But that actually does add up, and it's over $100,000 that we hope to go back and backfill for. So we're happy about that part. And this contract will go retroactive to April 1st of 2014. There is no end date just because those rates perpetually go into the future. Maternal child health is the next item under public health. It's a grant agreement under Title V, which is the maternal child health title. It is really to support mothers and children with special health care needs. Our amount of the award for 2015 is $64,401, which is a 6.8% decrease from 2014 award. I do not know what's behind that decrease other than it's just funding that they determine at both the state and federal level as it trickles down to us. The term is January 1st, 2015 through December 31st of 2015. Final item under public health, child and teen checkup contract amendment. This is again a language amendment, but I just wanted to bring it in front of the board just so that you were aware that these things do happen. And again, the mission of child and teen checkup is to serve children birth through age 20 who are on medical assistance and hope to again facilitate the health and medical services that they need. The language amendment is actually directly out of statute, so it's a pretty easy fix that they're looking for. Does not change the funding, which is currently at just under $139,000 from the original contract, and the term is January 1st of 15 through December 31st of 15. Final category, children and family services. Adult Children and Family Services is the name of an agency in our community that provides mental health services, specifically a service called Children's Therapeutic Services and Supports. We refer to it as CTSS. Family skills training, counseling for crisis, psychotherapy, diagnostic assessments, and group psychotherapy. It is a renewal contract. There's no change in the rates. It does serve children and families who are either underinsured or uninsured. The term is January 1st, 2015 through December 31st, 2015. And the final item for action, Greater Minnesota Family Services. This is our contract for family group decision making. They also do relative searches so that families that feel like there's a placement change that's going to happen, we want to make sure if there's any relatives that can care for the children, we do a full search of that, and they help us with that process. They also facilitate family sessions that look at the permanency need of the children and pull in all the family members to have a voice in that process. These are children that are either in Children's Child Protection Program or Children's Mental Health System. There's an increase in the rate, and it equates to approximately $300 per session that is held. The term is January 1st of 15 through December 31st of 15. And those are the action items I have, Mr. Chair.
All right.
I'll make motion for approval.
Second.
Got a motion and a second. Any discussion? All in favor say aye.
Aye.
Against? Passed.
Thank you. Thank you, Mr. Chair and Commissioners. A couple of items just to bring before you as far as outcome data from 2014. The first of these is some graphics about our psychiatric and therapeutic programs. I'm going to move through this fairly quickly. Excuse me. The first section of 3 slides are about our psychiatric services, and really what you see are graphs of month over month of admissions, the scheduled appointments, and the no-show rate. And then the bullets below kind of give you some comparison sense of how we're doing year over year, or really referencing the last year. You'll see in the psychiatric care that our patients admitted is fairly flat, and so it's actually a good news for us if we get some sense of where our plateaus are, and that's where we've been struggling, as you know, in MNsure and some other areas that you'll see that we'll talk about. The average of approximately 29 admissions per month is just slightly less than last year, and our overall caseload remains very constant and consistent compared to last year. The second graphic, scheduled appointments, you'll see those also are fairly flat. 7,409 appointments were scheduled for the 5 psychiatric providers we have. They're not all full-time, so you see the FTE percentage there of what that represents, staff against appointments.
Can I ask a question?
Yes.
On that first one, the admissions by month, it says there's basically 28 or 29 admissions a month. How can they do that because they never just stay a day, do they? I mean, they usually are there for 3 to 7 days or something?
No, so this would actually be our outpatient services, so this is an important clarification. So this is our medication management primarily, and so people that come in outpatient for psychiatric medications are the population that we're really talking about here.
Well,
so
not admission to the psychiatric hub.
Right, and I'm sorry.
I mean
yes, so
not the hub, but the
it's,
the
yes,
Southern Minnesota.
not to
Okay.
the facility. And that probably is a term that we use a little
got you.
broadly, because I would agree that generally an admission is to a facility, but we're talking about really an intake here,
gotcha.
and it's
I'm
outpatient.
sorry.
No,
Makes
it's
sense.
probably not the best term to use, Commissioner, I totally
that's
get
all
it.
right. That's all I got it.
Yep, so scheduled appointments was the next one we just did, and then no-show rate is actually an interesting one for us, and I think the board would be interested in a couple of pieces. Again, a fairly flat graphic throughout the year represented by the graph, but then dropping down to the bullets, you'll see a no-show rate of 18%, which is actually very favorable. It's a high no-show rate still, but in community mental health, it's around 25%. So we are beating the standard in that regard, and we serve a tough population, so we're actually quite proud of that, even though there was a slight increase of about 2% from last year. The diagnostic assessments have the highest no-show rate, so for somebody to come into that first appointment that the Commissioner was talking about, That's where we often have them not show up. The bad news there is that's a big block of time. So when they don't show up for that, we've preserved at least an hour and a half, if not more, to do that work, and then they no-show. The other good news or interesting news that I know I've shared with the board, that the lowest rate is actually for telehealth. The ITV systems that we have, people's engagement of that is higher than any other service we have offered. So there's a dynamic about people using that technology that they seem to like. It's not, I think, a big difference to our overall no-show rate, but it's nice that there's not a let-off when it comes to ITV. The next three slides are really very similar. It's just about our therapy program. So the first one was about psychiatric and really medication management, as we were discussing. And now you'll see our therapists that we have that serve people more on a therapeutic level in a face-to-face counseling service. First slide again shows the month-over-month admission rates. 230 patients were admitted over the year, of average of 19 sessions per month. And again, there's that word admission, but really new intakes. And then these numbers have been skewed a little bit when we compare to last year, because we did have a therapist who was out on leave during the year. And so all three slides will represent some let-off because our clinician time was down. Annually, the next slide, appointments by month, 2,042 appointments scheduled between the three providers, which is really 2.2 FTEs. And again, is reflected by the leave that we had with some of our, you'll see it ramping up at the end, and that's when our staff came back, and so we came back towards average. And then no-show rates for therapy actually were up a little bit more significantly at almost 4.5%. Our overall no-show at 17.78 is still very good, but that's just something we want to watch and share with the board over time, because it is a good outcome measure of people's desire to engage the services we're offering.
Quick question.
Yes.
On the admissions by month, so if it was actually 8 less per month, and it's like 80 or close to 100
people, yes,
fewer.
lots. Yes.
Oh, okay.
And that really is reflective of the fact that when your therapist is gone, there's less slots to offer.
Yeah.
And so that's what skews the overall.
Okay.
So it's a direct hit there as well.
A hard shift here, number 2 on the informational discussion items, is our disability services, and you'll see the map that I'm going to refer to here. It's pretty straightforward but very significant for our future. In addition to the MNsure data and the trend lines that aren't plateauing in healthcare, this is disability services, so people under 65 that need that new assessment that we've hired for. You'll see our numbers overall as a hub are really high in Blue Earth County. The 457 is the number of folks we have in our community that are our responsibility have been in the past. They both live here, and their county of residence is also here in financial responsibility. The next one, though, you'll see on the key, it says number from other counties. There's 335. So this is the big influx, is not only do we have a lot of folks that we've always served here, but the really significant change is DHS is now saying that we'll also reassess, like when people have due for another assessment, we'll also do anybody from another county of financial responsibility that actually live here.
my God.
So that's a shift. And that is a big number as well at 335. We haven't pushed go yet on this. It's slated for April that Nicollet County and ourselves would start going through that transition. But this is that issue that we've talked about the hiring of staff. We've tried to accommodate the shift in the big hours that are increased in the assessment. And then in addition, we're going to have another wave hit us of reassessments from people from counties that aren't ours that are going to influx into our system, and that's going to be another discussion about our staffing. Some of the specifics are on the data on the next slide, or in your packet, the next data set, and you'll see MnChoice's data under 65. I won't obviously go through all this, but you'll see new intakes, and down the left side you see how many do we have month over month, and these are new people now in this slide. The total time for the assessment for those individuals that we assessed, and then the average time to assess per assessment, and that's a really important thing. So lower right corner box, 7.5 hours per assessment. That's the thing that has really hit us hard already with our own folks, and now as we serve those import people, that's going to be, you know, doubly important to track and to try to staff for. Some of the bullets under the data summary, on average you'll see the 7.5 hours, and then we add another couple hours if there is an interpreter that's needed. So to some of the contracts that we just talked about, if we need to bring in an interpreter, it takes at least another couple hours on average. The projected numbers of new intakes and assessment per year is somewhere between 72 and 75, so that's actually a ramp up of even what we've experienced through this year so far. And then that third bullet, as of April, that's where it comes in. Blue Earth County is to assess 335 clients that have residence in our county, so COR is county of residence, so those are where you live, but are not our county of financial responsibility, CFR. And what's the CFR used to be that people had to assess their own folks. Now we're going to take on those people, even if they're not our county of financial responsibility, we're going to do the reassessments.
So is that for full assessments or just a min choice type thing? I mean,
well, that's a really good question, because we're hoping that the reassessments won't take quite as long as a brand new assessment, but as we all know, things change. So you really do have to kind of go through the process again. Hopefully if they can say, well, that's all the same, I'm in the same living facility and all this, that hopefully we can move through it quicker. And you do see a little bit, I was looking at some of this data myself, and you see just in the month by month that, you know, a couple like October and December in that box, you know, we were averaging more like 6 hours per assessment. So I'm hoping we can push that down and get better at it as time goes on, but the jury's still out on that. We're not sure.
And so that map is just showing, we've got, like, let's say if you take St. Louis County, we've got 2 people living here. If I look over at Redwood County, we got 8 from their county here.
Right.
And that's how that map is set up.
Yes, and so this is that where the people are that are currently distributed throughout the state. You're exactly right.
I wonder how we compare them with other counties.
That was my question.
Well,
How, we got numbers and all that. How does
just
it
by the color coding, we're #1 in the state as far as numbers. St. Louis County has a lot of imports, so if we did their numbers, you would see a huge base number, because they have a lot of group homes up in Duluth area, and so they're hit as hard as us. And actually, Rice County is another one that has a lot of people and a lot of imports, and so it's a big deal.
Assume Hennepin still would be the, you would think, or not?
But I think they export a lot of their folks. So from a statistical
import and
level,
export
yes,
and export.
from a statistical thing, they go where a bed's available, because they do have such big numbers. And so we have Hennepin folks and all of that here, and now we'll reassess them. So that's kind of the lay of the land, yes.
All
right.
So are we sort of a hub then for special needs in a sense too?
Yes,
I mean,
and I would say even beyond, normally we talk about like in our adult mental health, the 10-county area, we're a hub from a much bigger catchment area than even that, and that's something for the board to be aware of. There is a moratorium on new beds and new things and all of that, but if that's ever lifted, or as long-term care, as we all know is a big issue about how demographics will go into the future, as the baby boomers come through, this is going to be a big issue for our community to kind of keep a finger on the pulse with, for sure.
It's a huge expense for the county.
Absolutely.
Phil, does it come with additional funding then, these new assessments?
Yeah, Bob and I have talked a little bit about that. Of course, from an administrative perspective, the idea, kind of the promise, if you will, is that we'll be made whole through funding, and we have seen a big influx in funding. So as we come to you and talk about staffing, the whole idea of kind of the business element is that those two will marry up well, and I think we've seen that in the short term. There are things just in the math equation that we need to be thoughtful about, is that, you know, I think a lot of those formularies are built on the fact that you have a full-time staff that's kind of here all the time. Well, we know that people take vacations, they have holidays, all of that. So right away, we're worried that there might be a fundamental error in that, are we really going to cover all of our expense? So if I can come to all of you and say, hey, we really do cover it all, which right now I would say that is looking pretty healthy. we want to have some assurance that that's going to really be enough to cover the net loss. The real decision for the board will be, you know, growth, and that we are a hub. I mean, that is this whole talk, and then Bob's issue is the money there. And right now, I would report to you that I think the money is there. But we want to make sure that we don't get into a situation that as time goes on, there's even a slight gap, because we'll carry that gap forevermore. So we're watching that. I think that's something that Bob and I will talk about into the future, and there's a lot of reassessment about the funding as well.
We gotta wrap this up. We
Yes.
got a ditch hearing that
I
we'll go
can,
to.
you know, really just leave you with the public health piece, and there's some slides that have a lot of information. I really hope they look fairly self-explanatory, commissioners. Just real quick on the areas of public health, child and teen checkup, which we actually talked about. There was a language change in the contract, but you know, we're serving these folks with a battery of criteria for really primary health care. And so what public health does is make sure the docs cover this checklist for child and teen checkup. You'll see some demographics just in the bullet boxes of that we have an increase of children in our community at 2.5%. It doesn't sound like a lot, but these are fairly large numbers. So that's 122 more children in this past year, 31% increase in our healthcare outreach, which is really mailed material according to our public health mission to educate, and a 12.5% increase in our outreach, and that's more the face-to-face, the phone calls, and some of our car seat education pieces. And the graphics are really self-explanatory. Just to move quickly through for the sake of time, disease prevention and control actually is made up of these 4 different programs: immunization practices, hepatitis B. Some of these are pretty small, targeted programs, but important programs: refugee health and tuberculosis. If you look at the boxes and the bullets under the boxes, we have 13 clinics that need to be reviewed by the county each year, and that represents about 78 hours of service from our staff. In the area, if there's areas that need to be identified in a clinic, if they're subpar in some way, that would require more hours. Hepatitis B is a liver disease that is bloodborne, and a mom can pass this on to a child during pregnancy, and there is treatment for this, a vaccine, but it usually takes 6 to 8 months to deal with hepatitis B, and so we are involved in the case management of that. It's usually, again, a small population, but they really need this service, 5 to 10 cases annually. It's about 5 hours that we spend in those cases. Refugee health is actually a very small targeted population of folks that come to us through referral from MDH. And really the concern is what health concerns they might bring to our community, both individually for them and their families, but also in the fact that they could be in need of specific care. 7 to 12 cases are flagged for this, as refugees are known through MDH as our referral source. For those individuals, it's about 7 hours per case to make sure they get the full screening for health care. And then the coordination is, you see a range of 49 to 84 hours depending. The last one is probably the biggest one, and we've had some cases here in this last year about tuberculosis. And as you probably know, there's both latent tuberculosis, we could have been exposed and you're not contagious. And then there's folks that are actually exposed, contagious, and have the active disease. That is much more significant. So that's the second bullet, talks about that. It's 6 to 9 months of treatment for that, and we also have to make sure that we're quarantining or limiting the exposure to other people if people are active. 10 to 30 clients, but that includes both categories. 2 to 3 clients this last year had active. That's actually a big number, because we have to cast a net around those folks. Who did they contact, test, and make sure that it's not spreading. If they work in a place where they're exposed to a lot of colleagues, that can be a very ominous task. You'll see that 180 hours were
just
spent
for the one.
Just for the one.
Wow.
Yeah, it's a big deal when it happens, and so that was a big part of our story. We're always hoping that when somebody's at risk, that they come back negative or aren't active. In these cases, they were. Real quickly then, Home and Community-Based Services.
How quick is that, Phil?
What's it, how quick is it? Yeah, I don't know if it's
I don't
quick at
know.
all.
Maybe we should pick it up at the next meeting.
Do you want to?
Yeah. we
Yeah,
probably-
you know, we
I don't
really
know.
do. We're past
You
our
wanna stick
time
around,
for
Phil?
our,
Oh, you
this
wanna
meeting
s-
already.
Yeah, hearing schedule.
You know, I think this is actually real self-explanatory. You know, WIC is the last one,
Yeah.
and the Home and Community-Based Services are really what we talked about in the contracting. You'll see the big hours used there, but I don't think we need to do anything except to give you that information. If you're satisfied, I am certainly satisfied.
All right. Thank you.
Thank
very
you
much.
for your
Thank
time.
you, Phil.
Thanks.
Thanks,
Yep.
Phil.
Thanks much.
Have a good day.
We'll have to schedule more time next time.
Yeah. Well, we knew we were a little.
That's my fault.
Your name's Phil, right?
Okay. How are we doing? We need a 5-minute break?
I think we could do it afterwards, couldn't we?
All right.
Oh, wait, are you?
Let's
Sorry.
go on, JD 38 Improvement Acceptance Hearing. Craig?
Craig?
Okay, I can, welcome to the acceptance hearing for Judicial District 38 Improvement. The purpose of this hearing is to determine if the contractor has completed this project in accordance with the plans and specifications. If so found, the board will accept the project as completed and order the final payment to the contractor. If you have not already done so, please sign the attendance sheet. And we will now have Craig talk about the justification.
Jurisdictional documents.
Yeah,
here.
that's what I was trying to say.
Okay.
Thank you.
For jurisdictional documents for this particular hearing, it's all we have to do is send a notice, which was mailed on January 2nd of 2015 to all landowners.
Okay.
And that's it.
Does the board have any comments or questions?
Not at this point.
No.
Okay. Comments from the engineer, Chuck?
Morning, Chuck.
Morning, Chuck.
guys.
Morning.
Chuck Brindle with INS Group. We have reviewed the system, JD38 improvement that was on the east side of the city of Amboy, a new 38-inch pipe. Most of the work was done last year. In our specifications, we require that the contractor televise the system at least one freeze-thaw cycle after it's been installed. The televising was done this fall. There were a few things that were found. There was some concrete in the pipe, and there was another joint that needed to be repaired. Those have been done, so all the work is complete. The pipe looks good. There was seating that was done, intakes. There were a few extras on this project. Most of that is due to County Road, or Trunk Highway 30. MnDOT asked for some extra things. They wanted some pipes bored a little bit further, and thus the payment to MnDOT goes up by $32,000, I believe. So, everything's been completed. The only thing we need yet for final payment is the IC-134s, so we'd recommend approving the project and starting the warranty period.
Any comments or questions, Chuck?
No. Was there anybody else contacting either one of you guys recently about any concerns from
No.
the ditch there?
A few phone calls after the letters and basically said, what's this letter for? And they said they didn't have any complaints, so they're not going to show up for the meeting.
Okay.
Those were all the comments on JD 38.
All right, thank you.
And I haven't heard from anybody.
You haven't, you were kept for anybody?
I will now open the floor for comments from the public. This hearing is being recorded, so please come to the podium, make your comments, and please state your name and address. Any comments for JD 38? Any comments or questions for JD 38? Any comments or questions for JD 38? Seeing no comments regarding the acceptance of the contractor's work, we'll close the public comment portion of this meeting. And do we have a motion from the Drainage Authority? So moved. Got a motion?
Second.
A second. Any discussion?
Sounds good to me.
Nope, looks like it went
All
pretty
in
good.
favor, say aye.
Aye.
Against? That's passed. Now we'll move on to JD 28. All right. Welcome to the acceptance hearing for Judicial Ditch 28 improvement. The purpose of this hearing is to determine if the contractor has completed this project in accordance with the plans and specifications. Specifications. I knew I'd get that. If so found, the board will accept the project as completed and order the final payment to the contractor. Again, if you've not already done so, please sign the attendance sheet. Craig now will talk about the jurisdictional documents. I got it that time.
Okay. As far as jurisdictional documents, we have the notice was mailed to all landowners on January 2nd, and there are no additional jurisdictional documents regarding this hearing.
Okay, comments from the engineer. Chuck?
Chuck Randall again. The repair to JD 38 or JD 28, if you recall, this was the pipe that failed from a project that was completed in the late 90s. We were very careful with inspection on this and how things went back in. The pipe looks good. It was again installed last year, televised this fall. There is one section of pipe that there's some work that needs to be done. It's on branch 8 on the southern part of the watershed. The pipe is in good shape. It's in correct alignment, flowing correctly, but we did find that there were some tears in the side of the pipe that looks like when they were handling it, they must have bumped it or teared it, and you could see the leak on the televising. We recommend that work be done as warranty work. It's not significant. Structurally, the pipe is there. The main line itself looks real good. Everything is in good shape. There were a few extras on this. This was due to the large number of tile connections that we found out in the field and some of the alignment. One thing to note, when they were televising the pipe, the contractor accidentally went into the old pipe, and I started getting calls saying, what's wrong with this? And so the old pipe was televised again, and it was in really bad shape, and it has been abandoned. So we recommend final payment upon receipt of the IC-134s, and the contractor and the pipe supplier have been notified that there are some warranty items to repair. Any questions?
When would you expect that warranty work to be done with?
Probably before planting. We'd like it to be done within the next month or two. So,
And that's possible with frozen ground?
yeah, yep, should be able to get down and do that. They did the JD 38 repairs 2 weeks ago. It didn't have any issue. So.
Okay.
Do they actually take the pipe out, Chuck, and replace the pipe, or do they repair the pipe?
There'll be a repair to it.
Repaired, okay.
Yep.
Is this the one, I think I remember we were here for a hearing, and there were some property owners and on the initial meeting here with the board that were wondering if there was any credits on having work done by somebody. They thought maybe there was some faulty, not craftsmanship necessarily, but faulty product on the type of pipe being used, and that's why it failed 25 years ago, and they're just wondering.
We did get ADS did give us a discount on the pipe, so we bid that separately, and essentially we got it at their cost with no markup.
Oh, wow.
So we did save some money on this.
That's good to hear.
Yeah.
Yeah, that's good to hear.
And then our bids came in significantly lower also, so we did get a real good deal on this system.
And you guys had someone on site often for this project this time to make sure the proper installation was done, correct?
We had someone on site the entire time.
Entire time,
Well,
okay, I
yes,
can't remember
which
what.
typically we don't do, but,
Right, yeah.
but just to make sure.
Because that was some of the discussion was, it wasn't properly installed. So we,
Yeah.
between Chuck's staff and the constituents out there, I think there was somebody watching the way it was installed
And
at all times.
a few of us just driving by along Highway 22, we'd stop by and look, and we'd see all the sand over the pipe and compaction, and, you know, we were pretty satisfied. The contractor did a good job.
Good.
I wonder if soil type had something to do with it too, didn't it, or not?
Originally, yes. Yep.
Yeah.
And technology, I mean, it's
Yep.
changed,
Yep.
that's just that much.
All right. Thank you, Chuck.
Thank you.
Thank you.
We'll now open the floor for comments from the public. The hearing is being recorded, so please come to the podium and make your comments, and please state your name and address for the record. Any comments or questions on JD 28? Any comments or questions on JD 28? Any comments or questions on JD 28? Seeing no comments regarding the acceptance of the contractor's work, we will close the public comment portion of this meeting. Do we have a motion?
I'll make a motion for acceptance of the work that was done on JD 28.
Second.
We've got a motion and a second. Any more discussion?
Just a point of clarification, Chuck, now is that you're gonna pay the bill in full, so there'd be no contingency left, so you have something in writing that they're gonna take care of these warranty pieces, or you're comfortable with that?
The contractor has a bond that is
Okay.
good for 3 years from a
Okay.
warranty standpoint.
So you're okay with it?
Yep.
All right.
Yep, they're so minor that it
All right.
shouldn't be a big issue.
Thank you.
Yep.
All right. Any more comments? All in favor, say aye.
Aye.
Against? Motion passed.
Thank you.
Thanks,
Thanks,
everybody.
Craig.
Thanks, Greg.
Mr.
Now-
Chair, would you like to take a 5-minute break now?
Yeah, let's take a 5-minute break. All right. All right. We're gonna get back, and we have some human resources.
Just out of go
Mr. Chair and Commissioners, item number 3 in your packet then is the Human Resources Department agenda and report. All the items are informational this morning. First is we have filled a probation officer position. We also have promoted a person into our information system specialist position within the Human Services Department. And because of that promotion, we have initiated recruitment to refill a clerical specialist position. We also had a resignation in the library for our on-call, or for one of our part-time library clerks, so we promoted somebody from the on-call position to that part-time position and have initiated recruitment for the on-call position. And then we had a resignation of one of our programmers in our IT department, and so we've initiated recruitment to refill that position. And lastly, we had a part-time library clerk that has completed their 6 months of employment and are eligible for a salary adjustment.
So on the resignations, is that finding a different job or retiring, or do we know?
Most of these are situations where people have voluntarily resigned because I believe they've sought other employment.
Okay. All right. Okay, then we'll go to notary fees.
Mr. Chair and Commissioners, item number 4 in your packet is a memo dealing with our notary fees. Minnesota legislature amended Minnesota statute 357.17, which sets the rate that organizations can charge to provide notary public services. We do have people that approach primarily our taxpayer services department, but as well as our finance and administrative departments to have documents notarized. We're currently charging the $1 fee that was previously allowed under state law. With this change at the legislative level to increase that permissible fee to $5, we're recommending that the county adopt that fee for those 3 departments. We do also provide notary public services in our Human Services Department as well as our Community Corrections Department for clients working in those departments. So if they have need to have documents that are associated with the work done in those departments, we provide that service free of charge.
All right.
I would move approval.
Second.
We have a motion and a second. Any discussion on this?
So
Yes, sir.
we provide that service for free in the Human Services Department?
That's correct.
Okay.
Yeah, that was an issue I had too. I just wrote a little note to Bob
Yeah.
this morning because I was concerned, because some people that might need it pretty often or something and they're pretty poor, that's why they're here. You know, if we jacked it up to $5 right away, I thought that'd be kind of a big deal for some of them to have to pay that.
But we're talking, my understanding, we're talking about this just with administration, the finance department, and taxpayer services, right here in this building, correct?
That's correct.
We're not talking about over in,
Yeah.
No,
the
we certainly
government side.
recognize that that's a service that folks being served by the Human Services Department and the Community Corrections Department, that free service is a valuable service, and it really helps us in our administration of those programs as well.
Yeah.
okay.
The other thing I can see is that when I read this thing here, it isn't specific to those departments, you know? And I'm just wondering if you could just add right at the very end there, notary services to $5 for these 3 departments, and just
Well,
friendly
that
amendment.
certainly is something, you know, if you want to put that in the form of
Just
a
a friendly
motion.
amendment. if
You wanna,
guys would
you wanna
accept
make that as an
I'll make
amendment?
a friendly amendment that we just add those words
Just
for these 3 departments listed.
That's fine.
Yep. I don't know if you need a second or not.
Want a second?
Second.
All right. All right, let's vote on the amendment. All in favor, say aye.
Aye.
Against? So with the amendment, is there any more discussion? We'll vote on the motion to raise the maximum fee from $1 to $5. And all in favor say aye.
Aye.
Against? So moved.
Mr. Chair and Commissioners, item number 5 in your packet then is a memo dealing with a request that has come through Commissioner Stuenberg. He's been asked to continue to represent Blue Earth County on the AMC County Futures Committee. This committee looks at leadership, research and development types of activities for the Association of Minnesota Counties, looks at emerging trends and issues, and that help create and promote effective and efficient public services. And so I'm recommending that Commissioner Stuenberg be reappointed to the AMC County Futures Committee.
So moved.
Second? All right, I will not be voting on this.
You might need your vote.
But I will.
Could be close.
But I will comment on it that AMC does pay for this. All per diems and hotels and mileage is paid by AMC on being on the future. So it's a very good committee. When I was on the executive board for AMC, I was on there as an executive board member, but it's a very good committee. So thank you very much. We will go on with the vote. All in favor, say aye.
Aye.
Against? And it passes. Thank you.
Mr. Chair and Commissioners, item number 6 in your packet is a application that's been submitted by the Blue Earth County Fair Association to hold a large assembly. This is a winter demolition derby to be held at the Blue Earth County Fairgrounds on February 7th of this year. We have received the application along with proof of insurance and a payment for the application. The application has also been reviewed by the Environmental Services Department as well as the County Sheriff's Office. And so we're recommending approval of this large assembly application.
Second.
A motion and a second. Any discussion on this event?
They had one of these before, didn't they? Will?
It's been very successful
Yeah.
for them. They've always had good turnouts on it, so
Yeah.
it's a good event.
Yeah, they wanna get out of the house, you know, you can always you can have a demolition derby in the winter, yeah.
Sometimes when it's icy out, it's
It'll be
just
more fun.
Go downtown.
People, well, that's true. They could have fun in the traffic.
Well, I guess so.
All right. All in favor, say aye.
Aye.
Against? It passes.
Mr. Chair and Commissioners, item number 7 in your packet is the fourth quarter of 2014 donations, both monetary donations as well as in-kind donations. You'll see that the libraries continue to receive donations from the community to support the operations of the library. We also have funding for our Partners in Parenting program, along with, actually, I think the LeSueur County thing I'll talk to staff about in terms of that's maybe not properly classified as a donation, but rather a payment for services. So we'll take a look at that into the future. But at this point, the board would typically accept the donations report.
If we accept this, Bob, should we take out the LeSueur County?
I think that would be appropriate. I can certainly talk with staff and suggest that they use a different coding in the future.
Okay. So moved.
Second.
A motion and a second. Is this without the LeSueur County?
Correct.
Okay.
As corrected.
All right, as corrected.
I see my name on there, I don't remember what it was about.
1213, it must have been about being a Sandy helper, I would imagine.
Yeah.
So thanks for doing that.
Yeah.
You're my hero.
Ho, ho, ho.
Any more discussion?
Give us the mark.
All in favor, say aye.
Aye.
Against? It passes.
Mr. Chair and Commissioners, item number 8 is the financial status report for the end of December. So it's the end of our fiscal year. You'll see that the revenue came in at just over $79 million for the year, with expenses at just under $83 million. This was not unexpected. We had budgeted with an expected deficit of just under $5 million. We came in at about $3.7 million deficit. A lot of that had to do with the construction of County Road 17, where we received that turnback funding in 2013 and finished the project in 2014. So a large portion of that deficit is related to that particular project. There also were some deficits in our ditch programs, partly because of the change that the board adopted at the end of 2014, where we would utilize fund balance for improvement projects rather than going out and seeking bonding. So those two things contributed to the deficit that we did experience. You'll see on the interest for investments line that we did quite a bit better than 2013 and also better than expected with our budget. A lot of that has to do with market value of our investments. It's more a point in time sort of measurement, so it's not really cash in hand in terms of how this report is prepared, but obviously we're seeing a little better return on some of our investments, and that is certainly helping our financial position. In terms of our total revenue, it comes in at 92.1%. That's a little distorted because of the $5 million listed as use of fund balance. That's not really a revenue, but in order to present the information as a part of this report, that gets incorporated there. The year-to-date expenses came in at 96.5% of our total budget, so a little under budget, which is a positive development in my opinion. Looking down a little further on that page, the enterprise fund is the Ponderosa landfill. You'll see that we took in a little over $3 million in revenue there and had expenditures of $2.4 million. So again, a positive bottom line for the landfill, even with about $640,000 of equipment expenditures. So it's a positive report for the landfill.
So even with expenses, we gained $500,000 on the Ponderosa.
That's correct. It does go into a fund that then, you know,
Well,
helps.
that'll be helping pay for the new building.
That's correct.
Okay.
The second page lists our cash and investment balances. You'll see at the top part of that page that through some accounting adjustments, our total available funds is down to 32.6 million. Our 6-month operating needs would suggest we should have $42.5 million. We did move some money from the capital purchases account to that $10 million ditch fund to do financing of ditch programs. So you'll see that amount towards the bottom of this page under ditch funding from capital. So we just basically moved 10 million from the top portion of this report to the bottom portion, and that 10 million will then be used as we have major improvements in our ditch systems that we would typically buy bonds for. Otherwise, you know, our total county funds are just under 103 million, down from 105.5 million last year, so it does reflect the deficit that we showed in our operating accounts this year, but again, that was a planned spend down of some reserves. Be happy to answer any questions from the board if you have some.
I just have one on that, you know, that use of fund balance where it can't be moved over as a percentage. And it was still budgeted, wasn't it, somewhat, or not?
You're on the first page of the report.
Yeah, sorry.
Well, it is budgeted, but normally you would see that as a bottom line figure, as a loss or a deficit. We showed it on the top portion as a way to balance the revenue and expenses. So we knew we were going to pull from reserves, and so that's how we showed it here. Normally, if you finished out a year in a deficit position and you hadn't planned for it, it would just show up on the bottom line.
Oh, I see. So that 92% is really not correct, though. I mean, it's not.
Right,
really.
that's a little bit of a misnomer.
Okay, because it would be more in the 100% range, I'm sure, if plus.
Yeah, you know, we budgeted 85, well, if you back off that roughly $5 million, we budgeted about $81 million of revenue, true revenue, and we took in 79 million.
Okay.
All right. This was all informational?
That's correct.
Okay.
And I believe that's all we have for this morning.
All right. We are going to be meeting at Ummies at 11:30.
Any place? Where's that? Ummies is next door to
Peter Pit.
Holly-Eyes, or yeah, and Peter Pit.
Oh, that's where Ummies is,
Right
okay.
down there, yeah.
South front, okay.
Yeah. Yeah. We have a lot of good burgers down there.
Okay, I move to
Good
recess.
food. Move to recess.
Second.
Second. All in favor, say aye.
Aye.